Okay, Dr. James McCarthy, thanks so much for joining us from Memorial Hermann this afternoon. Obviously, we're all getting a lot of questions on the vaccine and this next stage 1B. We wanted to ask you a few of those questions. First, how soon will Memorial Hermann begin stage 1B?
So we've started in a very, very small scale, but we started on Monday with a small group of our patients that we could go in to try to test the system and get it up and running. But just to be clear, this is not available for everybody yet. We're just testing our infrastructure, first getting this vaccine out. There's still a lot of folks in Group 1A that still need the vaccine. There are still a lot of EMS providers, a lot of independent primary care and independent physician practices that we haven't gotten to yet. So we're preserving capacity so that we can continue to partner with them and get them done. But we do feel we've got enough slack in the system to dip our toe into that 1B. And that's really exciting that we can move out of the healthcare professionals and into that next phase of vaccine delivery.
So just because you're starting this next stage doesn't necessarily mean you've completely finished every single person in 1A.
Correct. And that's clear guidance from the state. They've said that we don't want you to slow down vaccine distribution. If you have the ability to expand your distribution beyond the 1A, meaning there's extra capacity, you go right ahead and do that. And that's what we've elected to do. But to put in perspective, right, I know everybody in Houston wants the vaccine. The number of people that are qualified for 1B is hundreds of thousands of people, even within just our kind of healthcare system, people who've come in and out of Memorial Hermann. So it's going to take time for us to move through that population. I know everyone wants to be first in the line, but we're gonna just have to move through this large number of people as we go forth with a more community-based vaccination program.
Where do you sign up? Is there a place, or if you're a Memorial Hermann patient or you see a Memorial Hermann provider, will you be directly contacted?
So the group we targeted initially are people who have a Memorial Hermann healthcare provider as their primary care physician, and we've pushed out a direct communication and email to them. So it is, I hate to say it, but it's by invitation only right now until we can build more capacity. And as we get more of the healthcare professionals done, we'll be able to expand capacity to offer to more and more patients. One of the real challenges logistically we have, though, is we don't just need to vaccinate you today. We have to do another dose 28 days later if you're on the Moderna vaccine, or 21 days later if you're getting the Pfizer vaccine. So we have to actually build enough capacity today that we're vaccinating you, and then in 28 days, we have enough to vaccinate you and somebody else for their new vaccine. So we're going to be expanding our capacity as we move through the month. But that obviously takes people. We have hospitals that are extremely busy right now. So it's just getting people signed up is a challenge too. So we've focused on a small population first till we can get the system right, and then we will expand it over the coming weeks.
And who is in 1B? How do you know if you're in that next stage? We've had a lot of questions from teachers and childcare workers. We've heard the state of Texas specifically talking about 65 and older and people with certain medical conditions. How do you know if you're in this group?
So it's varied a little bit state to state, and there are two ways to get into 1B. And the first way is if you're over the age of 65. So that's pretty easy. People can figure that out. The second is if you are 16 and up and have a comorbid condition that increases your risk to have a severe outcome if you were to get COVID. So things like organ transplantation, heart failure, kidney failure, cancer, diabetes, obesity. Those are all things that would put you into that 1B category. If you have questions personally, we recommend you reach out to your primary care physician who can help you understand the state's guidance and how it applies to your particular health needs. We know, and I know I'm getting phone calls from all kinds of folks that will, I have asthma. Do I qualify? And the answer for people with significant asthma is probably yes. But also, why did you just target 65 and over? Because that's the group we went after first. We went 65 and over as a targeted population that are seen within our medical group, just so we can get the process down. And I know there are many people that are in their 60s that have comorbid diseases that want to be vaccinated, and we're committed to getting it done as quickly as we can. We're just trying to move through a very large population.
So that's the only two ways for the state of Texas to get into 1B.
Some other states have defined the age differently. In some states, it's 75 and over. Texas has gone to 65. I do agree with 65. We see increased morbidity and mortality in that age group. So I think that's a good decision by the state, and I'm glad we can offer it more broadly. But it does increase the number of eligible people right now. That's just frustrating for everyone who wants to get in their place in line.
But teachers, childcare workers, not in the state of Texas.
The teachers and childcare workers are not as of yet defined in Category 1B. The next phases have yet to be fully defined by the state. There's a lot of speculation that the next phases will include what they consider essential healthcare or essential workers. So that might include teachers, daycare, meatpacking plants, things like that, where we know there's high potential for transmission and they're important to keep our society moving forward. But those are not yet defined. But the other clarification is 16 and up is not possible for the sites that are using the Moderna vaccine. Moderna vaccine is only approved for 18 and up. So if the site that you're working with, and this would actually be all of our community sites right now, we're using Moderna only. So it's really 18 and older for what's available right now. As we work through, and the challenges related to Pfizer are that ultra cold storage that's required. So that's really focused on our hospital campuses. And in that population, we focused on frontline healthcare workers. So we're trying to have two different work streams with our clinic-based vaccine strategy for our 1B patients and our hospital-based strategy for all the healthcare workers so that we can make sure we maintain adequate access for that 1A group as required by the state.
And our final question, where will people go physically to get these vaccinations? Will they come everybody downtown to the medical center, or will these be at different branches that Memorial Hermann has throughout the community?
No, we currently have 6 sites that we've rolled out, our clinical sites that we're using. We plan to expand that over the next 7 to 10 days to add several more. But the intent is to have not to have patients come to the acute care hospitals. The hospitals are exceptionally busy right now with COVID patients. And the last thing we need is people coming in who don't have to be on the hospital campus. So we're setting these up as ambulatory sites using our existing clinical footprint and some of our other physical assets that we'll be standing up vaccination centers in.
Got it. Anything else you'd like to add?
So the thing I'm going to add is that I need everybody to be patient. I know that everybody wants the vaccine. If you think of the number of Houstonians, right, depending on how you count, 3.5 million and climbing people living in Houston, the amount of vaccine delivered to Houston is 150,000 doses in total. It's not even close enough to get all them, but we're going to get everybody vaccinated. We just need everyone to be patient. We know that it's frustrating. We know that especially for people who think if they make a phone call, they're going to cut in line. We're not doing that. We're doing this really by invitation, picking groups and going methodically through so that we can get everybody who's in that 1B vaccinated just as quickly as possible, but it's going to take time. And I just ask for everyone to be patient. I know it's frustrating when you know someone who got on the list and you're not there yet. You have my commitment. We're going to get to you. It's just going to take us a little time to do it. In the meantime, this is no time to relax. Everybody wear a mask, wash your hands, social distancing. Please avoid New Year's Eve parties. The gatherings from Thanksgiving have put a huge strain on our healthcare system. We're sure we're going to pay for the Christmas the same way. If we can avoid the triple hit of New Year's Eve, that would be fantastic. So we can focus on getting people vaccinated instead of taking care of the sick.
Got it. Dr. James McCarthy with Memorial Hermann. Thank you so much.
Thank you. You have a great afternoon.